Good morning. Welcome. I'm Joe Kippley, the Public Health Director for the City of Sioux Falls, and happy to be here today to talk about raising awareness here as September is Suicide Prevention Awareness Month. This is a little bit of a preview. I'll hope to be back in January timeframe. We'll be talking about our community health assessment, where we kind of bring some facts and figures to the public on a pretty holistic set of topics. But today and this month, we're really focused in on suicide prevention at all levels of government. So, of course, at the local level with our friends at the Department of Health, at the state level, and then we also get some of our data at a national level from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And they have their most recent data is 2022, said that more than 49,000 people in the U.S. died by suicide in 2022. So that's one death every 11 minutes. So that just kind of is a table setting of just the scope and scale of this problem. More locally here in Sioux Falls, we saw an increase in 2023 up to 38 suicides. That had been averaging more in the low 20s in the prior 2 years, but still roughly 2 to 3 suicides a month in the city of Sioux Falls. And then at our state level data, we're unfortunately above the national average. So this is something as South Dakotans we need to be concerned with. Whereas the national average on a per capita basis, you're looking at 15 suicide deaths per 100,000. At the South Dakota level, we're seeing 20 suicide deaths per 100,000. And then within that, there's various health disparities. This doesn't strike every community equally. We see specifically in South Dakota, the Native American population is at higher risk with being at 55 deaths by suicide per 100,000 and 18 per 100,000 for a Caucasian population. So both of those are still above the national average. So we know within our Native American community and our South Dakota community as a whole, we need to be addressing this. So what are we doing at the city level? At the city Department of Health, we have Falls Community Health, so a primary care clinic, as well as outstanding health systems with Avera, Sanford, and the VA in the community. We have a lot of primary care services. And we, at Falls Community Health, we've got primary care providers that are providing primary care, of course, but a lot of primary care these days is mental health care. It's one of our, in our clinic, we see various diagnoses. You'd probably expect things like diabetes, hypertension, high cholesterol, heart disease, those types of things. But in our top 5 diagnoses, major depression disorder and general anxiety disorder are both in the top 5. So when we're talking about suicide risk and assessing people's mental health, our primary care clinic and other primary care providers around the community are really the front lines of the action in mental health. But we're also setting people up with mental health and addiction counseling, referrals to psychiatry specialties within our clinic. Also, if we see someone, we basically have questionnaires for our patients that a primary care provider would try to have a patient fill out a questionnaire at least once a year, kind of basically surveying them for thoughts of self-harm, things like that, and just general depression questions. We're trying to do that once a year, and if we do come across an answer that is alarming or a patient shares that they need help at that moment in crisis intervention, we also have relationships, of course, with community resources like Southeastern Behavioral Health, Avera Behavioral Health, and we'll make sure that they connect and possibly get even inpatient services at a moment's notice in real time. But ideally, we'd love to take care of people in an outpatient setting as well. So my message for the community really is that early intervention is key. Kind of the culture and how we talk about things is upstream of some of these issues. And so really 3 key points would be that recovery is possible, resources are available, and we need to reduce the stigma in asking for help. Us Midwesterners, I'm originally a Brookings kid, sometimes we are not willing to talk about our feelings or share or talk openly, but I've also lived in other parts of the country where people talk about the Midwest and South Dakota in particular as a place where you ask people how they're doing and you actually listen for the answer. And so that's something that I think we can take pride in, that are we talking to our family members, our friends, our neighbors, are we asking that question, and are we listening for for their answer and trying to get them the help. We don't expect every citizen of the City of Sioux Falls to be a mental health professional, but hopefully we know community resources of where we can turn to. And that's where I think I'm going to pivot some of our presentation here is kind of the community resources of community resources. When we think about the Helpline Center and what they do to connect the dots for people and get them connected to the right issue, to the right resource. So I'm going to introduce Amy Carter, the COO of the Helpline Center, and she'll come up and talk about some of the key community resources that the Helpline Center has, including the 988 number. Amy, come on up.
Good morning. Thank you, Joe. Yes, I'm going to focus my time on talking about the resources that the Helpline Center can offer for individuals who are experiencing suicide or mental health crisis, as well as substance use concerns. So in 2022, the nation moved to the number of 988 as a resource for individuals who are experiencing suicide or mental health crisis, as well as substance use concerns. This number really changed the landscape of things because it made it much more accessible for people to reach out for help. Just as Joe was talking about, it helped take away that stigma, and it made it for anybody could reach out for assistance. So 988 is available through either chat, text, or calling, which is also really important. We wanted to make it available for all generations, all people. Right now, the younger generation tends to use our chat and text feature more than the calling feature, and so we know that that's important to make sure we have options for people. So we offer, at 988, we provide immediate crisis response, but a lot of our calls and texts and chats are related to other mental health support and resources, as well as substance use treatment and support. And then also supporting those who have lost someone to suicide. That's a really critical piece of 988 as well. On the next slide, you'll see that 988 is a partnership in South Dakota between the South Dakota Department of Social Services, the Division of Behavioral Health, and the Helpline Center. We do serve statewide, and so DSS has provided the development and the funding and the plan in order to support the operations and implementation of 988. We answer 988 here at the Helpline Center in Sioux Falls, but it is answered statewide. And those who are answering our calls and texts and chats are individuals with advanced degrees in mental health and experience in behavioral health. So just as Joe said, not everybody can be an expert in mental health, and so we want to make sure that we have individuals responding to those that are reaching out who can respond in an appropriate way. And then follow-ups are also available to anyone who reaches out. This graphic, I think, is just really important to stress that help is 3 numbers away. No matter what sort of help you need, help is 3 numbers away. We want it accessible. We want it easy for people to be able to remember and know. So 988, I just talked about why someone would reach out to 988. 911 is pretty commonly known as far as emergency response for people. And then 211 is another resource in our community and statewide that is also answered by the Helpline Center that can connect individuals with more of community resources, financial support, legal services, government agencies, the public health services, things like that is how someone would access those is through 211. So now some data for you. This is specific to 988 for the state of South Dakota for the past 2 years. Over 20,000 contacts have come in to the 988 number. Of those, about 18,000 were calls, a little over 1,300 were texts, and then almost about 858 were chats. And underneath the bold ones there, you would see the Sioux Falls numbers specifically if you're interested in knowing how that breaks down for the Sioux Falls community. Some additional data that I wanted to share. Really an important fact about 988 is that 97% of the contacts that come into 988 are stabilized and de-escalated without further intervention. Why that's so important is that's a big goal and purpose of 988 is to take that burden off of 911 and other emergency interventions and eliminate that need to involve them when there isn't an emergency safety or immediate response needed. So 97% of the time that is happening, which is really significant. The other thing I would note is just 32% of the contacts to 988 are crisis related. And so I share that because you do not have to be in crisis to reach out to 988. You can be looking for mental health resources, wanting to talk about a friend or family member that you're concerned about, seeking information about substance use, wanting to talk about anxiety or depression. You don't have to be in that immediate crisis to reach out to 988. One other fact on this sheet that I'll share is that the average time to respond to a contact to 988 is just in 13 seconds, which is really remarkable and really important. We want to make sure that individuals reaching out receive that help immediately, because it's a big step to reach out for help, and so responding quickly is important. Just a few more facts here for you. As I mentioned, a lot of the callers a lot of the texts and chats come from the younger individuals, 29 and younger, and about 72% of our contacts are from females. And we've seen a 116% increase month to month since we had our data back in August of 2022 until June of 2024. So the information is getting out there, which is really important. If you want more information, we have a great dashboard on our website that you can access as well with all of the other 988 data. And then also on our website are promotional materials, which are available to anybody, any organization, to get that word out to people. One other thing I'd like to share that wasn't in the slides is that just recently the major cell phone carriers have done what we call geo-routing. And so individuals, when they are calling from a cell phone, they are now routed to the state from which they are calling. What was happening previously, just up until this week, is if I was using a 605 phone area code, but I was living in a different state, my call would get routed back to South Dakota. Now those calls are routed to the state from which they're calling, which is really important because it allows us to connect people with resources locally versus trying to respond to someone in New Mexico when they're living in South Dakota or vice versa. So it's really a great feature, and the 2 major cell phone carriers are on board already, and the 3rd one will come on in October. So lastly, as we talk about suicide prevention and awareness and taking away that stigma, today is the kickoff of the 437 Project, which is a great event that raises awareness and draws attention to suicide prevention and getting support to individuals. The 437 Project has 12 runners. It's a 4-day event. The runners run all the way from the west side of the state to the east side of the state. It's 437 miles, and the entire time raising awareness and funds to support individuals who are experiencing suicide or looking to support those families. So lots of coverage will happen for that, so please keep a lookout for that, and join us on Sunday when we have our celebration event when the runners return on Sunday afternoon at 1 o'clock. So, and with that, I think Joe and I are available for any questions.
Questions? Okay. Thank you all.
Thank you.